right, welcome to the Rocky Mountain MS Center's webinar series. This series is designed to give people with MS information to empower them to make the best choices for their lifelong brain health. I would like to thank the pharmaceutical companies who have provided support for this program. Thank you to EMD Serono, Genentech, and Novartis Pharmaceuticals. Today's presentation will be discussing how to prepare for a neurology appointment. The beginning of the webinar heavily focuses on how the clinic at the Rocky Mountain MS Center at University of Colorado works, but the information about how to prepare for and make the best use of a neurology visit will apply more broadly to most MS clinics. We will end the webinar with time for your questions. You can submit these using the Q&A feature on Zoom. Our presenters are Pauline Sock and Grace Warland. Pauline is a board-certified nurse practitioner specializing in neuroimmunology at the Rocky Mountain MS Center at University of Colorado in Aurora. She completed her Bachelor of Science in Business and Nursing at University of Colorado, and then completed her Master of Science Nursing from University of Northern Colorado. She holds a national board certification with the American Nurses Credentialing Center as an adult geriatric acute care nurse practitioner. She has worked primarily in neurosciences, and prior to her master's degree, worked as an RN in the Rocky Mountain MS Center. Grace received her Bachelor of Science in Nursing at Denver College of Nursing in 2014. She received her Master of Science in Nursing in Adult and Geriatric Primary Care with University of Colorado Springs in 2020. She has experienced working in primary care, geriatrics, and neurology. She enjoys working with patients to create treatment plans that address all areas of patient needs. She is passionate about patient education, advocacy, and mental health. This webinar does feature a lot of important information. If you missed something on a slide or want to hear it again, we are recording this webinar and it will be archived on our website at mscenter.org. All live viewers will get the recording automatically sent to them. You will also receive a link for our evaluation survey. Please take a few moments to fill this out to help us improve future programming. We'll reserve time at the end to answer questions, and we'll answer as many questions as time allows. Today's presentation is for educational purposes only, and all specific treatments should be discussed with your neurology provider. With that, we'll turn it over to Grace and Pauline.
Hi, everyone. Thanks for joining us this morning. I'm Grace.
And I'm Pauline Sock.
So we're happy to have you here and happy to help you guys get some information to prepare for your appointments. So we have a presentation that we'll be sharing for you here. And get that up there so you can see. Right. You guys seeing that okay? All right. So again, we have Pauline and myself. I'm Grace.
And so let's get started. There it goes. Technical. Alrighty. So this is our team here at the Rocky Mountain MS Center at Anschutz Medical Campus. So our top neurologists here, we have Dr. Corboy, Dr. Alvarez, Dr. Gross, Dr. Kammeier, Dr. Paquet, Dr. Schreiner, Dr. Shaw, and Dr. Wolf. These are our neurologists that are currently working at Rocky Mountain MS Center.
And our advanced practitioners, so which Pauline and I are two of our four. We also have Mindy Kimmel and Connie McMenamin. Many of you may know has been here for many years.
Yep. So. Alrighty. And then these are also part of our nurses are a big part of our team. So our infusion nurse navigator is Sean Hensley. Our MS nurses are Alex Johnstone, Phoebe Peterson, and Marissa Pitts. We also have an intake team to kind of help with scheduling and kind of helping with medication assistance, or starting with medication assistance. It's Carol and Breeza. And we also have a lot of our medical assistants that work closely with us as well.
So along with our team, you'll find we also have our fellows. So our fellows this year are Molly Molman. It's Dr. Molly Molman, Dr. Paul Crane, and Dr. Yomera Ardakani. You'll notice also we have a variety of residents and medical students. I did want to kind of take a moment and just introduce you to kind of what goes on with that whole process and what does that mean when you have fellows, residents, medical students as part of your team. I think it's kind of important when you're looking at working with an academic clinic setting, a lot of times because we are training our future caretakers, we really like to devote that time and help them to be as involved as possible in getting that good quality training with our neurologists. So you'll see oftentimes we'll have medical students. Medical students have not yet graduated. They have not yet taken their boards. They're not yet doctors, but they're in their graduate programs and working towards that end. Our residents are doctors. They have graduated from medical school. They've taken their medical boards, and they're now doing a postdoctorate residency to kind of figure out where they want to be. So a lot of times, so they'll do a residency in a variety of different settings to see, get experience in all of these settings, and also to figure out what they want to do going forward. Once they finish a residency, if they decide they want to do something as a specialty, oftentimes they will join a fellowship. And that's where our fellows, Dr. Molman, Crane, and Ardakani come from and where they come in. So these guys do work with our providers, our specifically our neurologists, to get this training. And some of you may recognize, if you do come to our clinic, Dr. Andrew Wolf was a fellow last year of ours, and we liked him so well that we decided to keep him. So that's kind of how that process works. So these guys are qualified doctors, but you'll notice that they do come in and they may start an appointment, start a visit, and work with our neurologists.
We also have a social worker that's part of our team. His name is Tyler. We also have he also has some coworkers that kind of follow, that will cover him sometimes, but Tyler is our main social worker here. We also were fortunate to add on a clinical psychologist, Dr. Courtney Legg. And more helpful tips here.
So, okay, so now you know our team, and people like to know some helpful tips about being successful as, you know, as far as working with our clinic, helping us work with you. And the number one thing is we want to see you. We want to see you every 6 months. We want to see you in person at least one time per year. And this can vary depending upon the clinic that you are working with. Our personal policy is to try to see our patients twice a year. Just MS is pretty significant, as you all know. And has a lot of pieces and moving parts and changing symptoms that we like to keep track of. So we like to see our patients at least twice a year, ideally in person annually, so that we can get a good neurologic exam on you to kind of clarify and verify that things are stable, or if they're not stable, to be able to catch those things. We also want to see you if you're having symptoms that aren't well managed and you're like, gosh, why do I keep feeling this pain? Why do I keep feeling this thing? What can I do about it? I'm on these medications, they're not working. Schedule an appointment, come on in and let's talk about it. A lot of times it can be just some tweaking of medications that we need to be looking at doing. So we want to see you for those things. We want to see you if your symptoms are worsening. We want to see you if you have new symptoms. And also just for paperwork. So sometimes, you know, we'll be filling out things for work accommodation or intermittent leave, FMLA work, paperwork, all that kind of stuff. We want to see you in clinic ideally, or at least virtually.
And also to kind of add to Grace's point with that, sometimes we want to see you sooner as well, because if we're starting you on new disease modifying therapies, we like to call it DMTs, sometimes we want to see you sooner just to see how the medications are going. And also sometimes, you know, the insurance process is a little bit difficult. And so there have been times where things have fallen through the cracks for patients. And I'm sure a lot of you out there have experienced this as well. So it's good to kind of touch base with your provider, talk about other options, and we can figure out things that we can do to get medications approved in a timely manner. So.
So that's you.
So helpful hint here. So we specialize in MS and neuroimmunological conditions only, and we want to we want to give you the best care that we can give you as possible. So just to this end, we may refer you to other clinics that provide better management for things such as headache, chronic pain, psychiatric conditions, neuropsychology, and other therapies like PT, physical therapy, occupational therapy, or speech therapy. I'm just letting you all know that we usually do not prescribe opioids here in our clinic. If it is some type of chronic pain management, we like to defer you over to your primary care or a pain clinic for this.
So who are you
We
gonna
call?
So who do you call when? This is always a big question and a valid one. So when do you call us? When do you call our team? So if you're having new symptoms, you've got new numbness or tingling, you've got weakness, things like that. If you are having symptoms that are worsening and lasting more than about 48 hours, if you've got questions regarding your MS, if you have questions about your medications, if you're talking about, starting a family, other life changes along that line, and for FMLA and disability paperwork, we want you to give a call to our nurses here at Rocky Mountain MS. And then we'll figure out, is it something that we need to actually set up an appointment so that we can see you? Is it something we can get a quick response to you online? Or is it something that we want you to be seen elsewhere for?
All right, so who to call? So we recommend that everybody at least has a primary care in their back pocket here, because there's even though you do have MS, you still have lungs, a heart, bones, all that good stuff. So we want to make sure that you are seeing your primary care. So you want to reach out to your primary care if you need refills on medications not prescribed by us. If you have symptoms of flu, COVID, UTI symptoms, so that includes fever, chills, body aches, coughs, and congestion, management of conditions that aren't MS, and also for an annual wellness exam.
So when do you consider going to urgent care? So urgent care, a good time to do that is, your primary care office is closed and you're having symptoms kind of along that infection line. You're having, burning with urination, frequent urination. You've got chills, you've got fever, you've got body aches, those kinds of things that feel a little bit different than your MS. It's probably a good idea to be seen by urgent care if your primary care is either not able to get you in that day or, it's after hours to get seen.
Right, and then who to call. So still within this topic, so please go to the closest emergency room if you're experiencing difficulty breathing, chest pains, any significant injuries with possible broken bones, some paralysis, so any issues with movement, and also the worst headache of your life. Those are pretty top things that are, yes, you need to go to the ER. We cannot help you with that.
So the other resource that we have available too is to use the portal. So the My Health Connection for us, I know many organizations have something similar. What is a good time and a good use of these messages? So a quick update regarding your condition or response to medication. So like, hey, last week you changed this medication and it's god awful, I don't like it, please change it. Or hey, this is working really well, thank you so much, I love it, that's amazing, thank you. If you have a question about a medication, hey, I started this medication and now I have this headache, is that something to expect, will it go away, etc. Appointment follow-up, hey, I forgot to ask this thing, or we talked about this and I had a question that is associated with it. And just to clarify, so you said this thing, does that mean X, Y, Z?
Alrighty, so the My Health Connection messaging system, it's a great quick response tool. Our nurses usually, your messages come to our nurses, they triage it throughout the day. Some messages the nurses can answer, some they can't, they send it to the providers or wherever else it needs to go. If there are multiple messages that are being sent, then we recommend probably an appointment. So if your message is kind of, if it's more than 2 or 3 messages, I'd say it's probably best to just schedule a quick follow-up appointment. It could be telehealth to kind of get everything answered and there's not this back and forth. Also, with these messages, they're not a quick response. So they're non-urgent medical messages. So that means a response, you probably won't get a response within the next 48 to 72 hours. So
We try our best.
yes, we do. We very much do.
Sometimes it sounds
Sometimes, yes, we're loaded with other things. There we go.
So appointment logistics. So you've scheduled an appointment. What does that actually look like for you? So new patient visits here at Rocky Mountain MS are 60 minutes. Return patient visits are 25 minutes. We like to have our patients arrive at least 15 minutes before appointment time so we can get you checked in, make sure you've figured out where to go. Unfortunately, this campus can be a little bit crazy at times. And so sometimes that means, with parking and all that stuff, arriving 30 minutes early can actually really benefit you to make it so that, you're not rushed. You have time to rest if you need to while you're on your way in, and to navigate that parking situation and or valet. If you are running late, it happens. I get it. Call the clinic. We do our best to see you. It doesn't mean that we can 100% do that, but we do try our best to do that. If need, just know that if it's been more than 15 minutes or you're going to get here and it's 15 minutes late, we may have to reschedule. And if we don't reschedule, even still, it may mean that your appointment's a little bit shorter than we would prefer it to be. But we try and accommodate as best we can.
All right, so the big $1 million question is what to bring to your visit. So usually this includes all this here on the list. I'll go through it. So your medical history, notes from any prior neurologist that you have seen, maybe even some primary care notes if they've done their own type of neuro assessments or done any testing prior to referring you over to us would be nice to know as well. Any copies of any lab results that you completed outside the UC Health system or any recent ones, doesn't have, even if you're here in the UC Health system. Biggest thing is MRIs. So if you, most likely that whoever referred you to us probably saw something funky on your MRI. And so they probably need to get an MRI and we would like to see that. So if you have an MRI that's on the disc, definitely bring it in for us. Bring it in with you as well as with the radiology report, excuse me. A list of your current medications, their doses, and who prescribes them, a list of questions, and a symptom log if possible, and a notebook to jot down information. It is a lot of information that's going to be thrown at you, and so it would be good, to kind of write everything down, and so, you get home and you're not like, oh, wait, what else did we talk about? So consider bringing a family member or a friend to kind of also help with remembering things and helping you get through the visit as well. So
before your appointment, if the ideal is to check to see that information is received. Sometimes we request the information, sometimes you request the information, sometimes the people that we're supposed to send the information have sent the information, but something has happened where it has not arrived. So it can be helpful to know that prior to the visit so that we can re-request and really check in on that. So check in to see that the information was actually sent and received. So MRIs, we really like to have the imaging and not just a report. So records, lab work, all that stuff. If it's something that you can't bring physically with you, we appreciate it if you're able to check to see that it's been received, just so we can follow up.
To do that, you just would call our clinic and speak with one of our front desk people to kind of see if everything's received. And yeah, that's who you would contact to confirm that. So some good questions to ask your neurologist when you first see them. So are there medications available to help with management of symptoms? What are common side effects of my medications? Because we see that a lot with people who are having these side effects and they're thinking, oh, it's just because of my MS, it's just because of this, but really the culprit could be a medication you're on. Other than medications, what can I do to improve my mobility and other symptoms? And are there any new therapies available?
So what other good questions? There's so many. And ultimately, you know, there's going to be questions you come up with that are way better than any I could suggest. And the most important thing is to write them down. Keep a notebook somewhere or even a running list on your phone of questions that you think of along the way that you're like, oh, shoot, I should have asked this, that, or the other. And also ask your family members, ask caretakers, for their questions. A lot of times they have good insight into what's happening as well.
Yeah. You will not, or we always hear this all the time where, you know, patients don't recognize there's some things going on, but it's always the family caregiver that'll bring up something in their appointment. Like, actually, it looks like she kind of walked kind of funky, and you're like, I don't think I walked funky, you know. So other people like to notice things. So what else should I know? Sometimes 25 minutes is just not enough for visits. So we want to make sure that you have all the information that you need to make the best choices in your care. So if needed, if we don't get everything discussed in your appointment, if needed, we can schedule an additional appointment by telehealth or in person to address any concerns not managed during the scheduled appointment.
And we look forward to seeing you.
And that is the end of our presentation, so we can open it up for questions.
Wonderful, wonderful. Thank you guys. We did have a number of questions submitted at the beginning or at registration, so let me share a couple of those. You mentioned how long new patient visits are and how long follow-up visits are. Is there any other thoughts you have on timing of appointments in between your sorry, I'm not sure what I'm asking. We'll move on and I can go ahead.
So anytime an appointment is a return visit, whether it's you know, anytime it's somebody we've seen before, that visit is typically 25 minutes. And that's why we note too, you know, with the addition of our three, including us two, nurse practitioners, it really did help to kind of open up a little bit more time and a little bit more freedom to get some follow-up time for questions and such in appointments even after a visit. So, you know, if you find that you're not able to get all your questions answered, or, you know, you're like, shoot, you know, 25 minutes, it's just, as I said, it's not always enough. MS is a complicated disease and it affects so many aspects of life that we encourage folks to, and oftentimes we will recommend a follow-up visit in, you know, a couple weeks to just check in on some of those other things we weren't able to discuss at that last visit.
Excellent. Can you share the difference between an advanced practice provider and a registered nurse?
Yes. So advanced practice providers, and that includes nurse practitioners and physician's assistants, are graduate prepared. So Pauline and myself, we are nurse practitioners. We actually both work together on the neurology unit at university. And so we have experience working with patients from that side of the bed, so to speak. And we then take that experience into a graduate level training where we're looking at more of the diagnostic piece, evaluation of results of studies, et cetera, and also disease management. So it's, you know, we are not the neurologists, but we're pretty darn knowledgeable, and we become more so every day. We work with a really great group of neurologists who are excellent at being available and open to any questions that we have, and providing also us with a lot of resources to make sure that we also are up to date on information. So as far as advanced practice providers, we are typically graduate trained nurses, or in some instances, physician assistants who have additional training in diagnostic and disease management.
Excellent. We've had a couple of questions about transitioning between neurologists. So I'm hoping you guys can kind of approach this broadly. We've got one person who is transferring within the same system, so many people will stay the same, but the neurologist will change. And then just in general, people are always asking, what do I look for in a new neurologist? What do I need to do to make that transition as smooth as possible?
Right. So if you're going for to an outside neurologist, like we said before, make sure you're bringing those records. The records are going to be the most beneficial for you and that provider when you're establishing care. Usually here, if we do have a patient who's transitioning to another provider that is retiring, Dr. Corboy, then usually we'll have them schedule a transition of care appointment, which is going to be an hour, even though it's a neurologist that's part of our team and they have all of our records and everything. We want them to still be seen for about an hour so that neurologist can get to know this new patient. Even though we have all the records, they're still within the same facility. We still make sure that that appointment's at least an hour. So
yeah, I think that, and you know, as far as what to look for, so I think it's always important to kind of take a look at your providers, and no matter what the provider is, kind of taking a look also at what is their a lot of times providers will have on their bio like a philosophy of care, a philosophy of treatment, and I think it's sort of important to peer at it and say, okay, you know, what things are important to this provider, and where will I fall in their spectrum of importance, because having that you know, connection and trust with your providers is so important. You know, and I think personally, working with the folks that we do here, we are so lucky to have these guys that, you know, they kind of balance each other out in a lot of ways, but also, you know, they're passionate about finding new therapies and finding new ways to treat things. And it's always like, oh, in this study, these folks are doing this thing and these folks are doing this thing. And it's like a lot of good new things to try. I think when it comes to looking at new caregivers or providers for care, it's important to kind of pay attention to those pieces of the puzzle to see who might be a good fit for you.
Excellent. And I will also recommend here our education programs. If you are looking in the UC Health system and you are looking for a neurologist at the Rocky Mountain MS Center, all of those neurologists have done presentations for us and they're available on our YouTube channel. So Conversations on MS is a great way to get to know a doctor's personality, or their Ed Summit presentations. So highly recommend our YouTube channel.
For sure.
Next question. Can you discuss more about the symptom log? What should a patient be tracking? How closely should they be tracking it? How much information does a neurologist need at the appointment?
So I think a symptom log is so helpful to know, to gauge what things are important to the patient and what things are really affecting your life. So it can be as detailed or not as you choose. And I think it's just helpful to really get a gauge of what's happening with your symptoms throughout a period of time. So not just like a few days. A lot of times I think it's easy to speak to whatever your most recent memory of your symptoms are, but sometimes we forget, oh yeah, no, they were real bad a couple weeks ago or a couple of months ago, and maybe there's something tied to it. Was it super hot? Was it, were you stressed
out? Yeah.
Did you
start a new medication? You know, things
all
like
those
that.
things. Exactly. So it varies per person and kind of to your tolerance level. Like I know I'm not going to be a spreadsheet person. But if you can even just say, like have a notebook that you could just be like, oh, brain fog. Maybe it was like a 2 out of 10 that day. Just write the date, write 2, because that's your scale. Things like that can be really helpful just to kind of get an idea. And that way, when you see what it's doing over time, you can say, boy, this really did decline during the summertime when it was hot, or this really did improve when I was sleeping better. So those things are helpful. Do you have
No, that's you said. You say the sleep thing.
Yes.
So we're good.
This is a before the appointment question. Should people be asking their neurologist if they are going to order labs ahead of time? This person wants to be able to discuss the results in person. And then kind of similarly, if someone has a test they think they want, how do they relay that information to the provider, and should they do it before the appointment?
Yeah, I guess you can definitely reach out to the provider before to see if there's any labs that they would want, so you guys can discuss it at your appointment. Sometimes, they want to wait until they actually see you and do an assessment, and then that's where they can kind of gather information to see what test is more appropriate. And then if they're going to start you on some medications, they may run other tests as well. So wouldn't hurt to ask. Some neurologists may do it, but some, if you're a new patient, might just want to wait till they lay eyes on you and do an assessment. So.
And again, it could be a good opportunity to say, hey, so you've ordered all these labs. Can I schedule, a televisit or something to follow up and go through this in more detail? Because certainly some people just need that information, and that's totally understandable. You have to be able to advocate for your own care, and that's from that standpoint. So I think that's key. As far as asking for tests, I think it's the same sort of thing where you're going to talk about it during your visit to say, hey, I've had this like fatigue or whatever, and I really want to have this test. And there's some things that are challenging to do from the standpoint of insurance, frankly. And it's if your doc says no, it's okay to say, well, can you just explain to me why?
Exactly. Just keep asking those questions.
What about if a person is relatively stable, doesn't have new symptoms? Is the twice a year visit still useful, and kind of what should they be focusing on if they don't have new symptoms?
Absolutely, it is still very important. We still like to see you twice a year, because a lot of times, even though you're not having anything new, sometimes we just want to make sure everything's good. We're doing a neuro exam on you, making sure things are still steady. And a lot of times when I have patients who come in and we give them a questionnaire to fill out, they usually say nothing's new, everything's good. So that as we're doing the visit, a lot of times things will pop up and they're just like, oh, actually, I just kind of, it wasn't a big deal, but I just realized I'm a little bit more fatigued. And then, then again, gets into a little bit more of an actual visit where we kind of just delve into investigating why they're fatigued. So sometimes, it is good to be seen, just one, for our benefit for that neuro exam, and two, there could be other things that you don't realize that are bothering you, and it just happens to pop up when we start to kind of probe questions at you, because we'll definitely do that. We'll just make sure, so are you sleeping okay? How's your fatigue? How's your cognitive stuff? We like to just ask you the little basic questions, and then, a lot of times it'll just be like, it'll turn on a light bulb for you. So, yeah.
And, and I think additionally, if everything's doing well, there truly are no changes. Everything has been stable as can be. I think it's still worthy of the conversation of, what's next? What other things should I be looking at? And making sure that this patient is optimized for the future as well. We're always so happy and relieved to see when a patient comes in and is like, nah, I'm great. And you're like, oh my goodness, that's so amazing. Yay. We're doing all the things. And how do we keep you that way is key. So kind of talking about, what are you doing for wellness? And also what are the new therapies? What are the new things that are potentially something to look to going forward?
How can I communicate with my provider that I'm having cognitive issues? Since I'm a woman, they just think that I'm stressed out. So kind of how do you relay the importance of symptoms especially when they're cognition related.
Yes.
So another thing is to hit on that point again about the symptom log. So definitely kind of keep more of a detailed journal about your cognitive changes that you've been noticing. Bring it up to your neurologist. Here we like to do neuropsych testing, which is more of an intense test. It's like 3 to 4 hours, maybe even more than that. And they like to assess any deficits that you're having cognitively. And sometimes they also, with those results, they'll kind of look at the deficits and also recommend some things to kind of help with those. But neuropsych testing may be something you can push for your neurologist, that if you're feeling like your cognitive issues are still not getting any better and you want to explore it, I would just continue to have that conversation with your neurologist, and maybe even see if they offer any neuropsych testing. I don't know what else I'm going to add on, Grace.
No, I think that's really honestly the key, is making sure that at the end of the day, you're advocating for yourself. Ideally, you're in a situation where you have a good relationship, a good rapport with your provider, and can say, you know what, this is not something that I remember ever having before. And I get that, yeah, I've had these stressors and here's what I'm doing to manage these stressors. It's still very bothersome to me and I need to get this figured out. But yes, requesting neuropsych testing, essentially is cognitive evaluation, can be very helpful at kind of getting a baseline of what's happening, to see where we can provide help. And it also puts it in terms of kind of a more detailed statement of these are where deficits lie. And it's like, you see, I told you I was having these things.
Yeah.
And so it can be helpful just to get that information.
Excellent. How, another question, how do I know, other than just what my neurologist is telling me, that I am receiving the best treatment? It's difficult to tell when I'm hearing about all these great new things out there for MS. So, yeah.
Yeah, and that's something you just, it's like, that's kind of a hard one to answer there. But yeah, I mean, all you can do is kind of keep yourself educated and keep that open communication with your neurologist. And kind of, if you're seeing all these medications that are being thrown at you in all these commercials, we're starting to see a lot more MS medications on TV these days. That just kind of jot the medication down, do your research, and then, discuss it with your neurologist and say, hey, do you think this is a good therapy for me, or if I'm interested in this? And they can kind of look, and it depends, on your medical history, your disease, your disease state and everything, if something is appropriate for you. But it's just good to keep that open communication and education open with your neurologist. So it's kind of hard to answer that.
I think, and I think like at the end of the day, again, I hope
Yeah.
you have a good rapport with your provider. Yes. I think that's the key.
Yes.
But saying, hey, I keep hearing about this medication.
Mm-hmm.
Yeah, like, could this be something that's helpful to me? And what is the benefit of this medication over what I'm taking now? And is there one? Because a lot of times it's not. I mean, all the medications are going to be, as you well know, everything on commercials is going to be very like, oh my goodness, this is the most amazing drug ever.
Yeah.
And it takes away everything that you've ever had bad. Sometimes it's not the case.
Yeah. Kind of the next step, if you don't feel like you're getting the greatest neurology care, or you just, you're unsure, do you have any thoughts on going about to get a second opinion? How important is a second opinion, particularly on potential differential diagnosis? If you're hearing, we're discovering new diseases every day.
Yeah.
How important is a second opinion, and any advice for getting one?
Sure. And again, I think to some extent, and we see here oftentimes second opinion requests, and there are some cases that are just slam dunk MS, and there are some that aren't. And I think the big thing is making sure that you are seeking what we call or refer to as like a higher level of care, meaning find yourself a provider who is an MS specialist, ideally with an MS center. And the reason being, these guys, are very siloed in their little land of MS and neuroimmunology. And they are very aware of all the mimics that are available, are out there when it comes to MS and other diseases. And so I think, you know, that's kind of the key is finding somebody who's ideally with an MS center to sort of get that evaluation.
I'm going to cut it into a quick plug here for our November 4th Education Summit. A couple of the presentations I think would be super relevant to your guys' questions. Dr. Jeffrey Bennett will be doing a presentation on the similarities and differences between NMOSD and MS. So just if you're having questions about your MS diagnosis, that might be informational. And then we will also be having a webinar in the next couple months with a neuropsychologist discussing neuropsychology and cognition and MS. So if you guys aren't already on our email list, please make sure that you get on that or sign up for Eventbrite notifications about our events, because we have a lot of really great things coming up. Next question. I've had MS for 18 years. My neurologist no longer provides physical exams, just does the 25-foot timed walk. Can you explain more about this test? What's the point? How should we approach it? Should I be trying to walk as fast as I can? I feel much safer in her hallway than I do on a sidewalk.
Yeah, so with that, I guess every neurologist is kind of different on how they assess people. We here usually still do physical exams on patients, even people who are older and they're not on any DMT. We still like to see that progression. So it gives us kind of I guess a tool to kind of look at the progression of your MS doing that 25-foot walk. A lot of times with that 25-foot walk, it's usually sometimes if we need some insurance approval for medication like Ampera, a lot of times insurance companies want that 25-foot walk as well. Usually we don't, I mean, you don't have to walk as fast as you can. Usually we just say, we time you to see how much you would walk in a normal, normally with that. So, but I'm not sure if she wants you to walk fast. So.
Yeah, and I would assume not. We want to, the point is to kind of know how your walk is on average.
Yes.
So, and obviously if you're outside on a sidewalk and it's uneven sidewalk, things are probably going to be even a little bit more slow. But my request is usually not for patients to walk as fast as they can, but to walk at their normal pace, normal, comfortable pace for them.
One theme that I'm getting from you guys answering the various questions is these are all great questions, and they're also great questions for your provider team. That you guys, it's sounding to me like you want there to be an open communication between patient and provider team. So all of these questions are great things to discuss at your appointment.
Mm-hmm. Absolutely.
Excellent. Are MS neurologists able to help manage MS if someone is unable to take a DMT?
Mm-hmm.
Should you still be having regular neurology appointments?
Yes.
Yep. We see a lot of people who aren't on any type of MS medications, and we still are helping them manage through things. So, you know, when it comes to like maybe some PT, OT, speech therapy, anything like that, we like to help manage that as well. But yeah, we definitely still want to see you. Maybe not as often. There's some neurologists maybe still every 6 months, but some of our neurologists, if you're pretty stable off DMT, sometimes or off MS medications, sometimes it's even annual. And even just some even yearly or every other year MRI surveillance as well that we like to still kind of check up on. So kind of depends on your neurologist, but at least here we still like to see you even though if you're not on any type of MS medications, because you still may be having some symptoms, and so we'll do symptomatic treatment. And you know, also if you're having, you know, if you're on disability, sometimes you need renewal for disability paperwork. And we like to heavily push for PT, OT, all that good stuff. And sometimes, no offense to primary cares, but sometimes they need to get you in and out of the office and you need to talk more about your MS stuff. And so that's something else we can definitely talk about. So yeah, so we here like to see us still. So
definitely.
Excellent. And just a note to the audience, we are coming towards the end of our questions. So if you've got questions to submit, please do so now. What about how much support should I be able to expect from my neurology office as far as referrals outside of the office for PT, OT, or community organizations that can help older adults stay in their homes? What kind of support should someone expect from their team?
So I think, um, I feel like most offices these days have some version of ability to connect patients with a social worker, possibly a case manager. We definitely do a lot of referral to outside facilities for, or, to other clinics within university, but also outside facilities, depending upon where a patient lives and all that. For urology, for physical therapy, occupational therapy, speech therapy, neuropsychology, all of those things, sometimes even a spine center, because unfortunately, as a person, person with MS, it doesn't mean you're immune to having normal like spine issues, and pretty much everybody's going to say, oh, it must be your MS, and sometimes it's not. And also sometimes to pain clinics. And so we do often provide those referrals. Sometimes we may say it might be best if this referral came from your primary care, just because it's not always appropriate for us to manage the information that comes back to the provider, the referring provider, in regard to that care. I do think physical therapy, like all those therapies, are key from our standpoint, and so we're always happy to do that, as well as urology. I think it's important for us to be involved in that care. I had another thought on that. What was it? Oh, yes. And I think, there are a lot of resources available for patients outside of, obviously we have you guys, Kelsey, so Rocky Mountain MS Center at ms.org, mscenter.org. There's also other really valuable resources if you're not in this area. If you go to the National MS Society website, so nationalmssociety.org, which actually even I wrote down their phone number because I know there was somebody who specifically had some questions about another area, and kind of not getting what they needed, it sounded like. But National MS Society offers a lot of information about what's available in each area, and also can provide care navigation, meaning if you need help getting appointments scheduled, if you need help getting transportation, if you need help with work accommodation, all of those things, disability, we are lucky enough to have a resource, and those of you who know Tom Stewart is super valuable to have for us when it comes to looking at disability. We reach out to him regularly ourselves with questions. He's fantastic, but not everybody has that resource. National MS Society can help you to get that information for your area. And their phone number, if you want it, is 800-344-4867. So if you're in an area outside and just don't have those resources, it's a good contact to have.
Excellent. And just as a side note, Tom Stewart is able to do disability consultations all over. So you can message the MS Center for his contact information. On the subject of kind of these multiple therapies, multiple care providers, do you have any tips to improve the communication within interdisciplinary teams within a health care system? So if you're seeing multiple specialists in the UC Health system, but then also, do you have any thoughts on kind of how willing providers should be to talk to other providers outside of the maybe UC Health system, or how to encourage that, how to ask for that?
Mm-hmm. Yeah. So, do you have thoughts on that?
Yeah.
I have so many thoughts, but go ahead.
Yeah, no, for sure. So we definitely here have a lot of patients who don't live locally, so they see other specialists outside of UC Health, and a lot of times, if we need information, we usually will ask patients to bring records from that specialist, or our nurses can reach out to kind of set up something where we can speak to people. We also have doc line here that people can call, or docs can call and get in touch with our providers here if they need to communicate any type of questions or plans of care going on within the UC Health system. We definitely have open communication with the specialist, which is nice and very beneficial because it's just a quick little chat over to a certain specialist, and then they can usually respond right away. So example, I had a patient who she's seeing a dietitian here and was having issues getting in. And so I was able to send a message over to one of the dietitians she was seeing, and she was able to reach out to the patient and get her scheduled and everything like that. So, but Grace had some other points to give me this communication stuff.
Yeah,
so Grace used to work for DocLine, so
I did, and I also have worked in primary care, and I will tell you, it can be very frustrating from the standpoint of frankly, every standpoint when it comes to communicating and even within the organization. And I think the challenge is trying to pull all the information together. I know Pauline and I both frequently have reached out to providers outside the system by phone or whatever to try and get some information. Sometimes it's difficult to do that depending upon what honestly what your day has thrown at you, and so although we try to make sure that we're able to connect with everybody, we can't always. So I think the most important thing is to collect that information as best you can to, oh, I went and I saw this person and here's my plan of care, and having that like summary of what's going on with providers that are especially outside of our system can be really helpful so that we can make informed decisions about your care with us. So, just kind of getting a handle on, oh yes, I did see my urologist, and in fact, I saw them a couple weeks ago, and here's what we decided about this thing. And I have been working with physical therapy on a regular basis. I have been doing these things. And sometimes we don't have access to those records. So having that information shared either through, you can always upload information on the portal for us. I know some systems don't have that capacity, but typically there's some way for you to get that information to your neurologist or your neurology team. But it's definitely helpful to kind of get that facilitated a little bit from your end as well, if you are able to do so.
And I would think this would be a great thing to put on that list of medications that you're bringing with you to appointments, is also what other specialists are you seeing? What other services are you taking advantage of?
Mm-hmm. Yes. Yes.
Are you guys familiar with the difference between the National MS Society and the MS Foundation? I know they're both great organizations. I don't know exactly what MS Foundation specializes in.
I don't, to be honest.
Yeah.
I know I really am more familiar, I think, at this point with the National MS Society. In part, I've actually been tooled around their site quite a bit for patients. I'm not as familiar with the foundation.
I believe they do a lot of educational brochures and things I've seen from them.
Yeah.
I'll add that to my little
magazine.
Yeah. Yeah.
And then one final question, not exactly appointment related, but I would be interested in your specialties. What are either some medications or strategies that you would suggest to combat nerve pain that are non-opioid?
Yeah.
So we have our top three. Grace and I mean, medication wise, usually we start out with gabapentin, Cymbalta, or Lyrica. It depends on, obviously the person and side effects and everything like that, and kind of throw something at you, see if it sticks. I don't know what else. What are your
Nortriptyline, amitriptyline? Those are other good ones that we use quite a lot of, specifically for nerve pain. And I know it sounds foofy to some people, but I think too, there's been a lot of really good data with, and these are all adjunctive, right? Like, so, we want to do everything we can in all the realms to help with these, to manage pain. But there's a lot of mindfulness and meditation techniques that sound like they wouldn't necessarily work, but really can very much improve your ability to manage pain along with these therapies. So, and I do think it's trying to find that combination that works for you is so important, because if we can avoid using high doses of these medications, that's beneficial. We know side effect wise, a lot of times
brain fog is the big one.
It's a big one.
We see a lot of times.
So. Exactly. And so, trying to kind of prevent causing more issues from side effects of medications is key. So trying to balance that with doing other more natural things and really recognizing that level of control. I know something that's not yet on the books, but is very much in the process of being formed. Dr. Courtney Legg is, as Pauline mentioned early on, a new addition to our crew, and somebody we've been wanting desperately to get on our team for a long time. She is a psychologist, and her role is just to serve our patients. And so, and that's neurology. We do share her with other neurology crews here, even though we're going to claim her as our very own. And one of the things that she's working on is putting together a mindfulness pain management class for our patients. I don't know how long it will be for that to come out, but again, the data on it is really, really good. And so I'm looking forward to that. So keep an ear out.
Yeah.
And that reminds me of some patient self-advocacy advice that I give out all the time in our MS 101 class, which is to have the conversation with your doctor about how comfortable you are with medications and how open you are to exploring non-pharmacological solutions to things. That should be an ongoing conversation that you're comfortable.
Yes.
And that's what I like to gauge when I see patients and they're having the pain. I'm always like, well, what's your take on medications? Are you leaning towards medications or kind of non-pharmacological treatments? And so that's where usually, hopefully a lot of neurologists will ask that as well, instead of just kind of throwing a med at you and being like, we're just going to give you medication. So depending on because it is your care too. So it's kind of nice, if what you want to do, I'm okay with helping. If you want the medication, sure, give it to you. We can try it. Or if you want to take on that non-pharmacological route, which that's how usually I am, I like to not take medications, then we can talk about other things we can do. Even PT sometimes even can help and all that good stuff. So yeah.
Yes, absolutely. And just knowing, pain is different for everybody. And that it's often a trial and error process from all sides, and obviously frustrating for patients and caretakers alike. And just to know, that communication again is key so that we can try and get things managed as best we can.
Exactly.
You guys have a very large toolbox, and questions and conversations are the key to opening it up and finding what works for each person.
Exactly right. Exactly.
Well, we are at the end of our questions today, so I just want to say thank you both for your time, for your expertise. Thank you, audience, for all of your great questions. Hopefully this helps everyone feel more prepared for their neurology visits. And again, this will be archived on our website and YouTube channel. So thank you.
Thanks, guys.
Take care. Bye.